Now I'll be percussing the posterior lung fields. Do you mind turning this way, please? This way. Nope, the other way. Thank you. Starting at the apexes and moving down the lung field, comparing side by side. Making sure to stay between the intercostal spaces. You can also percuss the lateral chest wall and the interior chest. Normal resonance sound was appreciated. Now I'm going to be percussing the costovertebral angle. This will create a vibration rather than a sound that'll indicate possible kidney infection. Do you have any pain?
No.
Do you have any pain?
No.
No CVA tenderness appreciated. Now I'm going to perform the test for tactile fremitus. Please say the number 99.
99. 99. 99. 99.
Fremitus is symmetrical bilaterally. Now I'm going to auscultate your lungs. Please breathe deeply through your mouth. Now lift your arms so I can auscultate the lateral lungs. Okay. Now I'm going to be auscultating the anterior lung fields. Auscultation is best done on skin. Lung sounds are clear to auscultation bilaterally with no wheezes, rubs, rales, or rhonchi. Now I'm going to be assessing your abdomen. Let's get you in the supine position. I'm going to cover you with the sheet. Cover your lower half, the sheet, and lift your dress up to the level of your chest, exposing only your abdomen. Upon inspection of the abdomen, the abdomen is symmetrical and protuberant. The umbilicus is midline and inverted. Skin is smooth and even with a midline surgical scar from the pelvic bone to the umbilicus. No signs of infection. Scar is well healed. Normal hair distribution. Normal pulsation of the abdominal aorta. Now I'm going to auscultate all 4 quadrants, starting in the right lower quadrant with the diaphragm side of the stethoscope. Vowel sounds are present and active. Moving in a clockwise direction, I will percuss all 4 quadrants, starting in the right lower quadrant. Normal tympani sound appreciated. Now I will percuss the liver. Along the right midclavicular line, at the level of the umbilicus, I will start percussing upwards until the sound changes from tympani to dull. Now I'll palpate the 4 quadrants, first with light palpation, starting in the right lower quadrant. Do you feel any pain?
No.
Now with deep palpation. Do you have any pain?
No.
The patient has no tenderness to palpation, no palpable mass, no rebound, no guarding. With my left hand, I will place it at the level of rib 11 and 12. And with my right hand, parallel to the midline, will palpate deeply. Can you breathe in slowly? Again. Again. The liver is not palpable. No hepatomegaly. With my left hand reaching across the patient, supporting the abdominal contents at the level of rib 11 and 12, my right hand just underneath the costal margin, pointing towards the axilla, I will palpate deeply. Breathe in slowly. Again. The spleen is not palpable. No splenomegaly. Splenomegaly. With my hands in a duckbill position, I'll palpate deeply. Breathe in. Do you have any pain?
No.
Breathe in. Do you have any pain?
No.
No tenderness to palpation of the kidneys. The kidneys are not easily palpable. Now I will palpate for the aortic pulsation with my thumb and fingers just above the umbilicus. Normal aortic pulsation felt. Now I'm going to sit you up. During the heart inspection, after auscultating with the diaphragm, I was to auscultate with the bell. Starting at the aortic, pulmonic, herb, tricuspid, and mitral. Now I'll be assessing cranial nerve 11, the accessory nerve. Turn your head. The other side. Shrug your shoulders. Patient is able to rotate her head left and right and shrug her shoulders against resistance. Cranial nerve 11 is intact. Now I'll be assessing your cerebellar. With your hands, can you pat your knees like this as fast as you can? Good. Now with your fingers, can you touch each finger to your thumb like this? Again. Other hand. Again. Now with your finger, touch my finger. Touch my finger. As fast as you can. Now with your other hand. Okay. The upper extremity fine motor and coordination is intact. Now can you take the heel of this foot and touch it to your shin? Now the other side. Lower extremity fine motor and coordination is intact. Now I choose to check the tricep reflex. I'm going to support your arm. Relax your arm. With the hammer, I'm going to hit the tricep tendon above the elbow. Relax your arm. Reflexes are 2+ bilaterally. Now I'm going to be checking the patellar reflexes. Please relax and dangle your legs. With the hammer, I'll be striking the patella. patellar reflex is 2+ bilaterally. Now I'll be testing the Achilles reflexes. With my hand supporting the foot in a dorsiflexion position, I'll use the hammer to strike the Achilles tendon. The Achilles reflex is 2+ bilaterally. Now I'm going to be testing if you can sense the position of your great toe. With your eyes closed, I'm going to be asking you what position your toes are in, your great toe is in.
Up, down, up, down.
Now I'm going to be testing your sense of vibration in your great toe. I want you to tell me when the vibration starts and when it finishes. I'll be placing the tuning fork at the bony part of her great toe.
Start, done. Start, done.
Sensation intact bilaterally. Now I'm going to ask you to please stand up. Okay. Now, with your arms at your side and your feet together, I want you to close your eyes. Know that I'm right here next to you if you need any assistance. Okay. Negative Romberg test, no significant imbalance or swaying. Now, can you walk heel to toe? And back. Okay. Normal gait. And I'm going to wash my hands. This is the end of my head to toe assessment.